Hi, it's Dr. Greg Jantz. Here we are. What is the link between hypoglycemia and depression? Here at the Center, a Place of Hope, for the last 40 years, we have integrated medical and have a medical team that looks at these kinds of issues that could be contributing to depression. And what is hypoglycemia? Now, I'm coming strictly as a member of the team here at the Center, a Place of Hope, and this is not intended to be prescriptive. Hypoglycemia needs to be looked at by a medical professional, but hypoglycemia, commonly known as low blood sugar, occurs when our body lacks sufficient glucose, which is our sugar, our main fuel for our brain and body. Here's some of the symptoms to be aware of. Headaches, dizziness, confusion, fatigue, and in severe cases could be mood swings and some pretty significant depression. This is why we look at the whole person. What could be, if blood sugar levels are interfering or contributing to depression or mood swings, we want to know that. What causes low blood sugar, and why does this happen and it leads to depression? Well, it affects the brain, impact on brain function. Blood sugar levels drop in the brain experiences, really it's an energy deficiency, and that's where you're going to start having all these symptoms that are undesirable, like the depressive symptoms. Now there's the role, number two, of diet and exercise. Obviously highly refined sugar diet and too much caffeine can cause spikes and crashes and ups and downs related to the blood sugar. We do need to look always, is this one of the factors? Could there be other things like low vitamin D, hormonal levels? What's going on in the body that could be contributing to depression or anxiety? Now, the word balanced nutrition. Yes, I know, balanced nutrition. Whole foods, our more complex carbohydrates, and our proteins. Good proteins to keep that blood sugar regulated is so important. And I can tell you, for me, makes a huge difference. All right, excessive caffeine. What's excessive? Well, I worked with a guy that did 10, 12 cups of coffee a day. And yeah, that would have been excessive, and the effects that it had on him. We know that the sugar, these are things that are in destabilized blood sugar levels, and it's going to affect your mood. So sometimes we need to do more frequent, smaller meals of protein, but lots of great information available in my article here between hypoglycemia and depression, a little more detailed information. I just want you to know there is a correlation, and properly looked at, treated, if it is an issue, can make such a huge difference.